Good evening students, welcome to GDC classes and another video lecture on medicinal chemistry. Hope you all are doing good. So without wasting any time, let's start my video lecture on anti-adrenergic drugs. So what are anti-adrenergic drugs? Anti-adrenergic drugs are basically also called as sympatholytic drugs. So sympatho means sympathetic system and lytic means to break down. So basically these sympatholytic drugs work by blocking the action of the sympathetic system. Okay. Now as these anti-adrenergic drugs, they have some structural similarities with the neurotransmitter of the adrenergic system. Now neurotransmitters like epinephrine are norepinephrine. So basically these bind to the adrenergic receptor and instead of stimulating them, they block the adrenergic receptors. Now these adrenergic receptors are basically of two types, that are the alpha receptor and the beta receptor. Now here in this video we will study about the alpha receptor and for the beta receptor next video. Okay. Now alpha receptor, these are basically the adrenergic receptor that respond to the epinephrine and the norepinephrine. Now epinephrine and norepinephrine are the neurotransmitter of the adrenergic system and this alpha receptor is a G protein coupled receptor. Now this alpha receptor is further divided into the two subtypes, that is the alpha 1 receptor and the alpha 2 receptor. Now talking about the location of these alpha receptor, now alpha 1 receptor is basically found at the smooth muscles of the blood vessels, then the eyes, the smooth muscles of the urinary tract and the reproductive system. Okay. Now talking about the alpha 2 receptor, it is found at the presynaptic neurons. Now moving forward towards the classification of these anti-adrenergic drugs. So first is the alpha adrenergic receptor. Now these alpha adrenergic receptor are further subdivided into two parts, that are the non-selective blockers and the selective blockers. Now these non-selective blockers are the blockers that act both on the alpha 1 receptor and the alpha 2 receptor. So they basically block the alpha 1 receptor and cause the vasodilation effect, and they act on the alpha 2 receptor, or they block the alpha 2 receptors at the presynaptic neurons. Okay. Now talking about the selective blockers, these selectively block the alpha 1 and the alpha 2 blockers. Now as if we talk about the norepinephrine, now this norepinephrine, they act at the alpha 2 receptors and results in the negative feedback mechanism. That is, they block the release of the norepinephrine. Okay. Now as these non-selective blockers, they act both on the alpha receptor also and the beta receptor, the alpha 1 receptor also and the alpha 2 receptor also. Now as this alpha 2 receptor is blocked by this non-selective blocker, so this will result in the release of norepinephrine. Now due to this release of norepinephrine, it will result in the stimulation of the beta 1 receptor. Now this beta 1 receptor stimulation will result in the tachycardia and various other cardiac related problems. So this tachycardia or various other cardiac related problems is the major side effect of this non-selective blockers. Okay. Now further, the non-selective blockers are divided into other classes like the 𝘂𝙀𝙎𝘾𝙬𝙾amines that have a drug called as phenoxybenzamine. This is basically the irreversible drug, non-selective drug. Second is the ergot alkaloids like the ergotamine and ergocriptin. Third is the hydrogenated ergot alkaloids. Okay, so these have a saturated ring. Okay, now fourth are the imidazolines like phentolamine, so it is an reversible tolazolin. Okay, now fifth is the miscellaneous drugs, chlorpromazine. These are not pure anti-adrenergic drugs. Okay, now selective blockers, first is the alpha 1 selective blockers like prazosin, terazosin, doxazosin, elfuzosin, tamsulosin and silodosin. Okay, now alpha 2 selective blockers like yohimbine. Now moving forward towards the structure of these drugs. Now medicinal chemistry is about the structure, so here we're gonna study about the structure of the drugs in this class. Now first are the non-selective alpha blockers. Now first is the 𝘂𝙀𝙎𝙾𝙬𝙾amines. So what are 𝘂𝙀𝙎𝙾𝙬𝙾amines? So these 𝘂𝙀𝙎𝙾𝙬𝙾amines at beta position, they will have a halogen group attached with the alkyl chain and a amine group. So these are 𝘂𝙀𝙎𝙾𝙬𝙾amines. Now here the first drug is phenoxybenzamine. Now this phenoxybenzamine is a non-selective and irreversible alpha adrenergic antagonist. Now this non-selective drug is used in the treatment of 𝘂𝙀𝙎𝙎𝙬𝙁. Now what is this 𝘂𝙀𝙎𝙎𝙬𝙁? Now this is basically a rare condition, or we can say a rare tumor at adrenal medulla, which basically results towards the overproduction of catecholamines. So this phenoxybenzamine, this can help in the treatment of this pheochromocytoma, or helps in the in controlling this catecholamines production. Okay, now talking about the structure of this phenoxybenzamine. So as from phenoxy, we can say that it will have a phenyl ring with oxygen. So in this structure we have a phenyl ring with the oxygen, so phenoxy. Then second is we have benza. From benza we can say it has a benzene ring, so here we have a benzene ring. Then amine, so we have a amine group here. Now as it is a phenoxy, as it comes under 𝘂𝙀𝙎𝙾𝙬𝙾amine, okay, so it will have a halogen group at beta position. So this is the alpha position and this is the beta position. So at beta position we have a halogen group, that is chlorine attached, and an alkyl chain. So this is the alkyl chain that is attached to the amine group. Okay, so phenoxybenzamine. Now moving forward towards the ergot alkaloids. Okay, so ergot alkaloids, these are basically we get from the natural source. Okay, so ergotamine is the first ergot alkaloid. So it is a partial agonist and a functional antagonist. So what does this mean? So depending on the situation, it acts as an agonist and an antagonist. So when it acts as an agonist, it only acts as a partial agonist. So whenever there is a condition that norepinephrine is not present, or it is present in a very low amount, so at this particular condition, this ergotamine, it acts as a partial agonist. partial agonist means it cause a very mild vasoconstriction. Okay. Now whenever the norepinephrine, the amount increases, so it acts as a antagonist. Okay. Now talking about its structure, now in its structure we have a ergoline ring plus the peptide tail. So what is this ergoline ring? Here this structure is the of ergoline ring, and here this is the peptide chain, peptide tail. Okay. Now moving forward towards the ergocryptin. Now ergocryptin, this is also the partial alpha adrenergic agonist and an antagonist too, depending on the situation of the norepinephrine presence absence. Okay. Now its pharmacological role is basically as a dopamine receptor agonist, but it also acts as an anti-adrenergic receptor. Okay. Anti-adrenergic antagonist. Sorry. Now talking about its structure, it also have a ergoline ring and a peptide tail. Okay. Now moving forward towards the hydrogenated ergot alkaloid. Now what is this hydrogenated ergot alkaloid? In this, the ergoline ring, that is present in its structure, it is saturated, not whole ring, but at a particular place it gets saturated, and due to this the selectivity of this ring increases and it decreases on side effects too. Okay. Now this example of this hydrogenated ergot alkaloid is the dihydroergotamine. So it is a semi-synthetic derivative of ergot alkaloid. So talking about this ergoline ring, here, now here it is saturated. Now here we can see we have a double bond here, but if we see in a dihydroergotamine, the double bond is now saturated here. So this is basically done to reduce the side effect and change the receptor interaction. Okay. So this also have a ergoline ring and a peptide chain. Okay. Or peptide tail. Now moving forward towards the next class, that is the imidazoline. Imidazoline means it will contain a imidazole moiety in its structure. Now first is the tolazolin. Now tolazolin, in my last lecture on adrenergic drugs, I have mentioned it as an non-selective agonist. So this tolazolin, it also have an action of a non-selective agonist, but its main action is as an antagonist. So I have classified it there also, and now here also we have tolazolin, so don't get confused. Okay. Now tolazolin is a non-selective alpha adrenergic antagonist. Now it has a vasodilatory property, so it can cause a vasodilation and help in treating a peripheral vascular disease. Now as these anti-adrenergic drugs, they cause vasodilation. So due to this vasodilation, we can see some symptoms like headache and nasal decongestion. Okay. These are the side effects of these. Due to this vasodilation, we get these side effect. Okay. Now moving forward towards the tolazolin. So it helps in treating the peripheral vascular disease. Okay. Now talking about the structure, now it has a imidazole ring. Okay. Now from the structure we can see it has a tolazolin. So from tola we can see, from tola we can say toluene. So what is toluene? Toluene is just a benzene ring attached with CH3. So here also we have a benzene ring that is attached to CH3 that is attached to imidazole ring. So it has a very simple structure. Now we can remember it easily, that is the tola. From tola we can say toluene. We have a toluene here and imidazole ring attached to that. Okay, so tolazolin. Second is phentolamine. So in phentolamine, phentol, phenyl, from phento. Now first we will study about, say we can say it is a non-selective alpha adrenergic antagonist. Okay, it also have a vasodilatory property. As it is causing vasodilation, so it will have a side effect of headache. So okay, now it can also cause an increased heart rate due to the reflex tachycardia. So I have already told that, as it is also a non-selective alpha adrenergic, so it is also having a side effect of causing tachycardia and other cardiac problems. Okay, so phentolamine. Now talking about its structure, phentol. So we have a phenyl ring with ol, that is OH. So here we have a phenyl ring with OH. So we have two phenyl ring with OH 2 times. Okay. Then as it is an imidazolin, so it will have a imidazole ring or imidazole moiety in its structure that is attached with amine, and it has a phenyl ring with OH group attached to its amine group. Okay. So this is the structure of phentolamine. It is also very easy to remember. Now moving forward towards the miscellaneous drugs. So these miscellaneous drugs, first is the chlorpromazine. Now these miscellaneous drugs, these are not actually the pure alpha blockers. They can have a side effect of causing orthostatic hypotension. Now talking about its structure, so chlor, so means it will have a chlorine in its structure. Here we have a chlorine. Prom, from prom we can say it has a propane chain. So here 1, 2, 3 we have a propane chain. Okay, so chlorpromazine, it also have a very simple structure that is easy to remember. Now moving forward towards the selective alpha blockers. Now in selective alpha blockers, first one is prazosin. It first in alpha 1 selective blocker. So first is prazosin. Now this prazosin is a selective alpha adrenergic receptor antagonist. So it can cause vasodilation and lower the blood pressure. Now these are selective alpha blockers. So they will not have a side effect of reflex tachycardia, as they are not blocking the alpha 2 receptor. Okay. Now they cause a vasodilation effect. Okay, they cause vasodilation. As they are causing vasodilation, so they can cause headaches. Okay. Now they lower the blood pressure and relaxes the smooth muscle in bladder and prostate. Now prazosin, from its name we can say pra. So from pra, piperazine. So it has a piperazine in its structure, prazosin. Okay. Now these all alpha 1 selective blockers, these are basically the quinazolin derivatives. Okay. So here we have a quinazole ring that is attached to the piperazine. Okay. So this is the structure of prazosin. Now talking about the second alpha 1 selective blocker, that is terazosin. Now terazosin, its structure is almost similar to prazosin. Okay. Now just like here we have a quinazolin ring, here we have a piperazine, just the difference is here. Now here we have aromatic ring, and here the aromaticity is not there. Now this is the saturated ring. So terazosin, it has a better dosing convenience than the prazosin. Okay, it is a longer acting drug than the prazosin, the terazosin one. Now third is doxazosin. Now all these three structures, the prazosin, terazosin and dexazosin, the structure is almost similar of all three, and out of all these three, the doxazosin is the longest acting. Terazosin is also a longer acting but lesser than doxazosin but more than prazosin, and the prazosin is short acting. Okay. Now talking about the structure of doxazosin, it also have a quinazoline ring, piperazine ring, and here this is changed in doxazosin. Okay, so structure are almost similar, so they are easy to remember. Now fourth is 𝘿𝙂𝙎𝙎𝙎𝙬. Now this 𝘿𝙂𝙎𝙎𝙎 is basically uroselective. Uroselective means they will basically act on the smooth muscles of the urinary system. Okay, so they specifically act there, and it is used in the benign prostatic hyperplasia. Now what is this benign prostatic hyperplasia? Now like here, this is, let's say this is our bladder. Okay, now let's change the color. Now here we have a prostate gland. Okay, now this is the bladder. Okay, and this is the prostate. Now here urine, it get passed. Okay, so this is the normal condition. Okay, now when we talk about the benign prostatic hyperplasia, now these prostate glands, they swell up. So due to these swelling, the urine, it can't be passed from the bladder, so it remains in the bladder, and it can cause the urinary infection, or the urine will not be able to pass, the urinary flow will be restricted at this particular condition. So this 𝘿𝙂𝙎𝙎𝙎, it can be helpful at this type of condition. Okay, now moving forward, we have tamsulosin. Tamsulosin, it is also a highly uroselective. Okay, like 𝘿𝙂𝙎𝙎𝙎, it also targets the alpha-1 receptor, as it is an alpha-1 selective anti-adrenergic receptor, anti-adrenergic drug. Okay, now it mainly acts at the prostate, the bladder, neck, urethra. Okay, and it has a minimal effect on the blood pressure. Basically this alpha-zeusin and this tamsulosin, these do not have any effect on the blood pressure. They are not used for the reduction of the or controlling the blood pressure. For the other drugs are used for basically for hypertension treatment, we can use them, but now these two are used for these two are uroselective, so for urinary tract problems we can use these two drugs. Okay, now moving towards the alpha-2 selective blockers. Now these alpha-2 selective blockers, now these have a very limited therapeutic effect. Now due to this limited therapeutic effect, they are not used in humans very widely. Okay, they have a very high side effects too, so they are not basically used in humans, but in some veterinary medicines we can use alpha-2 selective drugs. Okay, alpha-2 selective blockers. So 𝘂𝙎𝑚𝑏 here is the example. Sometimes we use them, but basically we don't prefer the alpha-2 selective blockers. okay, for the treatment. Now so hope you all understood the video. So thank you.